All right, so here's an easy way to remember a lot of the details about the quad muscles. All you have to do is to always treat your quads like royalty. Let me show you why. Now the quads, or Quadriceps Femoris, consists of 4 different muscles in the anterior compartment of the thigh. We have the rectus femoris, the vastus lateralis, the vastus intermedius, and the vastus medialis. Now the most important muscle for our purposes today is the rectus femoris. I want you to think of the rectus femoris as the queen of the quads. Well, why is she the queen? Well, because she's front and center, she has feminine name, which kind of reminds me of female and queen, and most importantly, she's supported by her 3 vassals, aka the 3 vastus muscles. If you're not big into feudalism, vassals back in the day were basically the rich landowners that supported the crown. So the vastus muscles are kind of like these vassals, supporting and backing up our queen, the rectus femoris. All right, so let's check out the origins and insertions for these 4 muscles. So starting with our queen, the rectus femoris is the only quad muscle that originates above the hip. So the vassals, the vastus muscles, are working and dealing with the land, but the queen, the rectus femoris, is up here. Her highness is enjoying kind of the better view from the box seats, so she's up here above the hip. Now she does have 2 origin spots, the anterior inferior iliac spine right here, and then a small groove right above the acetabulum. Now for her vassals, the good news here is that the name of the vastus muscles tells you exactly where each one is. So the vastus lateralis is the most lateral of the quad. It originates off the greater trochanter and the lateral edge of the linea aspera. Now you would think since the quad muscles are in the anterior compartment, they would stay in the anterior, but actually they kind of come posteriorly and go right on the edge of the linea aspera. So just remember, they're more posterior than you really think. The vastus intermedius covers the front of the femur, and the rectus femoris would cover that up and overlie that there. And then the vastus medialis is the most medial of the quads, coming down here on the posterior side of the femur again, on the medial edge of the linea aspera. Now as you can tell from all this red here, you can see basically the vastus muscles, like greedy vassals, take up the majority of the land of the femur. The poor peasant adductors are kind of crammed into this area here on the linea aspera. It's like kind of the run up the mountain, while the vastus muscles take up most of the good land. And then the hamstrings don't really get anything except for a small sliver for the biceps femoris short head right around here. But again, the vastus muscles, like greedy vassals, take up the majority of the femur, even coming to the back and taking up a lot of that posterior femur space as well. Now for the insertion, it's basically the same way a queen and her vassals would all come together and join forces to go overseas to wage a war maybe. These muscles all kind of come together and join forces at the distal end of the femur at the quadriceps tendon. So all these muscles run distally, they then come together at the quadriceps tendon, which would be here, which then inserts on the patella. From there, another tendon comes out of the patella on the inferior side that connects the patella to the tibia. This would be the patellar tendon, and it would insert at the tibial tuberosity on the tibia. But it's all connected: muscle, quadriceps tendon, patella, patellar tendon, and finally tibial tuberosity. For the innervation, all of the quad muscles are innervated by the femoral nerve. So as we covered previously, the femoral nerve innervates all the muscles in the front of the thigh. So femoral, think of that F for front, and I'll remind you of all the muscles in the front are supplied by the femoral nerve, except of course the psoas major, because it's a major pain in the blank. But again, femoral nerve innervates the front, and I'll remind you that it innervates the quads as well. Finally, for the actions, the quads are the main knee extensors of the body. So if you imagine this knee flexed and these muscles contract, it's going to pull at the tibial tuberosity and cause knee extension. However, our queen, the rectus femoris, like a queen in chess, has more than just one move. Since it crosses the hip and the knee, it can also help with hip flexion and knee extension. So just remember, the queen there has more than one move. It performs hip flexion and knee extension, unlike the rest of the vastus muscles, which only do knee extension. All right, so next time you're thinking about the quads, just think about a queen, and that'll help remind you of all these little details. As always, thanks for watching, and of course, good luck on your next test.